The report covers a number of different areas, including complete legislative change, but also it starts to look at the culture of the way that law is actually thought about and used right now, as well as the things that could be acted on short of or in advance of full-scale legislative change. I think it's a fair observation that the legislation as it stands has promoted quite a punitive approach to people that use drugs. And in many instances, the measures that have been taken that were well-intentioned, of that I've no doubt, haven't necessarily met the needs of the individuals concerned. And as a result, we have incredibly high levels of imprisonment within this country, and we also have got the drug death levels, which none of us are proud of and we need to act on now. I think the legislation is part of the answer, and I think the way in which we can take this discussion forward to find things that we can act on right now is a really important part of the solution.
The original Misuse of Drugs Act in 1971 was set up to criminalise, prosecute and probably eradicate the drug problem. But history has shown us that that is certainly not the case. In fact, it probably hampers recovery from drug addiction, probably stops people seeking treatment. You know, these people are now, people with drug problems are probably more in need of medical attention than criminal prosecution.
You know, I think in past conversation it was kind of seen the law as punitive rather than protective. If that was changed, it would expose guys and lasses to an earlier intervention into recovery support, recovery services, and that might just be the one intervention that gets them into recovery.
The stance that I'm coming from is in the service I work in, it's harm reduction delivery. So when we outreach to see a person, we deliver a harm reduction intervention, which is basically regarding safer injecting practices, highlighting if they've had BBV tests done, because blood-borne viruses has been quite a significant issue in the past few years regarding people using kind of discarded needles in injecting sites and not having that access. We also would be advocating as well for the safer consumption facilities. These would probably stop a lot of the drug deaths, because there would be experienced people there to intervene if there was any issues occurred, and also it would get rid of the injecting sites about the city centres where people go in and they're very unhygienic, lots of discarded needles and paraphernalia, where people could go into a safe environment. Their anonymity would be protected as well. Conversations then spark up where then we're able to people are linked in with services like Colin was speaking about. So I think in general, if the law changed, it would make a massive difference to people's lives in respect to getting the help and support they need and treated like somebody that needs help rather than being a criminal.